On January 18th, the Centers for Disease Control issued a new report that suggests pandemic relief policies helped reduce medical debt for thousands of U.S. households. The report was the National Health Statistics Report. It collected and compared data from 2019 through 2021, looking at the national health interview surveys from each of those years. Their findings was that the percentage of people and families having problems paying for medical bills decreased in the years of the COVID pandemic when relief was made available. And we'll talk about examples of that relief in just a moment, but let's look at the numbers first. The number of people who had trouble paying medical bills dropped from 14% in 2019, closer to 11% by 2021. Overall, females had a harder time paying medical bills than males, and younger adults had a harder time paying medical bills than older adults. The rationale for the decrease from 14% to 11% is being attributed to, like we said, pandemic relief considerations. Important variables in a house was health insurance coverage status, family income, if your state had expanded Medicaid or not. And remember, pandemic policies were also credited for helping to decrease child poverty and uninsurance rates by 2021. Here's what some of those policies look like. Continuous Medicaid enrollment during the COVID pandemic. States were not allowed to drop people from Medicaid even if they would have otherwise fallen out of eligibility. Increased Affordable Care Act subsidies thanks to the American Rescue Plan Act and Inflation Reduction Act. And cash benefits like stimulus checks and the child tax credit, which issued advance payments to help support families during the pandemic. And the feds also tell us decreased utilization of non-emergency health care helped keep some of those bills down for families. Looking forward, some of those changes are coming, however, to that pandemic relief. Continuous Medicaid is set to expire as states begin their unwinding process, and that start date was set by Congress as an April 1st start. The Affordable Care Act subsidies were extended, like we said, thanks to the American Rescue Plan Act and Inflation Reduction Act, but that only takes us through 2025. And then once again, as you know, stimulus checks and advance payments of the child tax credit ended as of the close of 2021. You could read more from the CDC and their new report and other resources in the description below.